I just want to welcome everyone to the River Valley Black Chamber of Commerce's first Health and Wealth Expo. It's about to be amazing. What's up, everybody? It's your girl Felicia from Magic 1013, and I'm excited to be here today with you all. Today is the River Valley Black Chamber of Commerce's first Health and Wealth Expo. And we're so excited to be here today. We are talking to providers in our community that look like us, provide service for us, to us. And it's going to be an amazing day of information, inspiration, and all of the things that we need to level up when it comes to our health. Now, I have two amazing health professionals with me right now, and I'm going to intro them and we're going to have some dialogue. Hi. Hello. So I've got, and I'm going to start with ladies first, Dr. Kim Jackson. And Dr. Jackson, I'm going to let you say what you want to say about your business, but the biggest thing is you are a family medicine physician, author, and philanthropist. So we're going to go back to that in a second, but let me wrap around to Dr. Chambers here, and then we're going to dive in. So we also have Dr. Wesley Chambers, and Dr. Chambers, you're an OBGYN and in private practice. Yes. Lots of questions for that. Lots of questions for both of you. So let's start with you, Dr. Jackson. How often do you talk to patients, and how long has it been before they get to you where they have seen a primary care physician? Like, do you run into that a lot where people are just not really, keeping up with maybe that part of their health care?
Oh, absolutely. So thank you so much for having me here. So excited to be talking about this topic and about Black health and wealth, how they combine and work together to help us all live our most abundant lives. So as a family medicine physician, I run into this often because a lot of patients, they'll do acute episodic care. That's my lovely brother here. Problems.
Yes.
Even sometimes gynecological problems, but they don't think about the intermediate things where they don't know, like the silent killer, high blood pressure. They don't know if they're drinking, feeling very thirsty, they have diabetes. So I'll meet people sometimes where they've gotten out of the hospital and they've been told they need a primary care physician. And then also just folks in the community based on their family members that'll say, hey, you know what, this person just recently died, they may have had cancer, or this was going on, I need to get my health checked up. I had a gentleman that come to see me, he turned 65 and he was like, you know what, I've been hearing if they're going to basically take me out now, so I'm still going to start taking care of myself at 65 when he retired, because he wants to enjoy his retirement years. So I see a lot of persons that don't really think about primary care sometimes until they ran into some issues, and then they realize that's important, and they definitely seek out wanting to see a physician that looks like themselves.
So is it fair to say that we could use the analogy of how some people, not all, some people with their cars, they don't necessarily get the maintenance done until something major happens, and now you need this big overhaul, and it's more expensive, it's more intensive, it's more all of those things. So is it fair to make that comparison?
That's an excellent comparison. I actually use it myself. I'll tell persons, just like you need to get your tires rotated, your oil changed, that's your body. You need to make sure you get the lab work. You need to get your pap smears. You need to get preventative tests, as well as chronic management care to make sure your body's at its fullest potential. And so if you put these things off, like with your car, the next thing you know, you need a new engine, So you need things to be done that just would have been fine if you had just gotten the intermittent care in between.
And lastly, the percentage. What percentage of those patients look like us that wait?
So unfortunately, there are a lot of percentage. And so, as far as the exact number, it probably varies on the region because that would depend on the healthcare benefits that you have in your states. Like there are some states that have better healthcare benefits, so people are seen more often and seen more sooner. Particularly, say in Alabama and Georgia, which are considered to be some of the poorer states. A lot of times, these patients, it may be 50 to 60% of those that are putting off care that haven't seen someone in a while. So don't quote me on that, but just anecdotal information that I receive from folks when they are getting to me, and I wish they would have got to me a lot sooner. So it's a large percentage of those persons that look like us that are putting it off. off. But these reasons, in addition to the healthcare benefits you may have in your state, socioeconomic factors, the sometimes mistrust of the medical system, or some of our persons just don't trust the system because of previous things like the Tuskegee experiment, right? And just the fact that some people just feel like if I can just pick a root by the river or take some type of, and there's nothing wrong with homeopathic or holistic therapies, but you need to do it also with your doctor to make sure you're doing the best care. So those factors can prevent people from seeking primary care earlier when they need to be.
And we're going to wrap back around on some of that. We're going to get to some amazing information with Dr. Chambers. So for our viewers, we are really deep diving when it comes to why do we wait so long to find a primary care physician, and then how hard is it to find one that looks like us, and what questions do we ask, how do we break some of these myths? So those are some things that we're really talking about today. And as far as when it comes to your profession, Dr. Chambers, I'm going to ask the same question. Do you run into a lot of patients who have maybe waited until now it's a problem? Now, I'm feeling something in my side, or, is this my ovary? Should I be scared, or what's going to happen next? So how much of it is preventative, and how much do you see that's, it's just way past what it should have been?
I have a lot of thoughts on that. So with regard to obstetrics, because half of what I do is obstetric care, taking care of women that are pregnant. And some women have waited until they're actually feeling a fetus moving in their abdomen before they actually seek prenatal care. So yes, we see that often, if a woman has irregular cycles, or just has reasons to not really pay much attention to their menstrual cycles, they may not know they're pregnant until the second or the third trimester of pregnancy. And so I do have women coming to get prenatal care much later than would be ideal if we were going to provide, the best care that we could possibly provide. We also have women that, and I take care of exclusively women, so I'm not just trying to focus on women being, not taking great care of themselves.
Absolutely.
But we do have women that are not pregnant, that have families and have loved ones who they've been the caregiver for, and it takes up a lot of their time. They're taking care of grandchildren and parents at the same time, and so they come to me and they say that, well, I haven't seen a gynecologist in a decade or 5 years. I haven't been paying much attention to my health because I've been spending so much time taking care of my family or taking care of other people. And so I see that very often. And my rebuttal is always, well, if you are not in your best state of health, then your ability to care for these other people that you love so much is going to be diminished. If you're not here to care for them because you're sick, then, what are they going to do?
So here, can I interject another analogy with this compared to putting your oxygen mask on first?
Yes, on the
so
airplane.
that you are able to care for, if that is your scenario, where you are taking care of other people, how can you really effectively do that if you're not showing up well yourself? So
Exactly.
that would be
you might get 2 or 3 masks on other people before you pass out, but if you don't have your mask on, you're gonna pass out eventually.
Yes. So again, the same question that I asked Dr. Jackson. What is the percentage of your patients that have waited? What is the percentage?
So I would say for obstetric care, the best way to approach it would be to seek care as you're planning the pregnancy. So to come to the doctor and say, hey, I'm thinking about carrying a pregnancy to term for 10 months. I'm thinking about stressing my cardiovascular system and every other organ system in my body for a 10-month pregnancy. I would like to survive this. I would like to have a healthy outcome for myself and my baby. What should I do before I get pregnant to optimize my health? That would be ideal. And so I would say the percentage of patients that are doing that on the obstetric side is very low. Yeah, so I a lot of times how I'll counsel patients in order to try to encourage them the next time, I'll say, pregnancy is like a 10-month marathon. Nobody just rolls out of bed and says, I'm going to run 26 miles today, right? So you shouldn't just be accidentally being like, oops, 10-month marathon coming up of a pregnancy. So we should be optimizing our health, doing all the basic things to live a healthy lifestyle before a pregnancy arises so that we can have the best outcomes.
Absolutely, absolutely. Now, I do have a question that's going to apply to both of you because, again, the reason why we're here is to shed light on providers that look like us, that provide care to us. How do we shed light on them? How do we let our communities know that you all are out here? So with that being said, what is something that can be done so that people know more about who you are, where you are, because there are patients out there who are looking, and that might be one of the reasons why sometimes they wait, because they're looking for a provider that looks like them, or maybe the list is a little long because the number of providers that look like us is low. So can y'all speak to that if you would?
Sure.
Yeah, absolutely. So essentially, there's several factors with that as well, right? As far as finding physicians that look like us, ways that they can do it, family members, referrals are important. The majority of patients now, when they find their doctor, they're finding through insurance referrals, right? So a lot of times that information may or not be available and they can't just say, look at your name and guess. So in some cases, things that we do are like commercials or ads. We do events like this to let folks know that we're out there. I have a nonprofit organization, Physicians Working Together, so we do healthcare town halls. Dr. Chambers participated in an event we recently had, Mindful Wellness in Phoenix City, Alabama. So we've taken time out of our schedules to let people know, hey, we're here. We're also generally on social media, whether we have websites or pages where we're letting folks know that we're here, and they can generally at least look at our picture and say, hey, that looks like a brown dot. But definitely it's probably more that could be done. So events like this where we just get out in the community and let people know that there are docs that look like you, that provide care for you and your family, are ways that we can be able to let more people know that we're around and we're available.
Absolutely. Dr. Chambers?
Yeah, I think I have a lot of patients that hear about me from family members. My father, having been in this area for a couple decades, helps. So our name, people know our name and we kind of know what they're expecting to get if they come to us. But yeah, like you said, community events like this. I just sponsored a Little League football program in the area, and so I'll have a billboard out there at the park, so a lot of young, mothers should see that and be able to put two and two together that Dr. Chambers is actually. I have patients that come to me sometimes like, I don't know, I thought you were a white man this whole time, and but yeah, so they'll be able to see my picture and know that that's not the case.
Absolutely. Now, has that ever happened with you, Dr. Jackson, where they say, I thought you were?
Yes, so one of the things that sometimes I deal with, sometimes my male colleagues don't, is like a lot of people call me about my first name.
Okay.
So the deal is when you hear Dr. Jackson, they may not know, but a lot of times people will lean toward maybe she's a black, physician. When you hear Dr. Kim, it's a lot of Asian docs, and so they'll be coming in, they'll be like, oh my gosh,
I love that.
I didn't know you were black. And so, but the funny thing is with ads, with information and things like that, like you said, a lot of referrals are from friends and family. That's probably our second number of referrals because the number one is the insurance. They generally know who they're getting when they're coming through the door. So that's always a good thing for them. And they'll seek you out. So we have patients that literally will say, and I know we've heard this before too, I came to you because you were a black doctor.
Right.
I wanted a black doctor. I wanted someone that can talk to me and understand where I'm coming from. And statistics show that black patients get better care from black physicians. And I think that's pretty much probably any cultural, ethnic collaboration or any type of experience that people have, because when you do get where your community is coming from and you have those experiences in common, or you can basically not be as biased as some other cultures can be when they're taking care of our patients, they'll get better care.
So we have put a lot of information in just a small amount of time. We're wrapping up now this particular session, but what we want to let the community know is look on and all social media for your brown docs, as one of the doctors called it up here, your brown doc, community events like this, and social events and sporting events and all of that. So there are various ways to find providers that look like us. Thank you, Dr. Jackson. Thank you, Dr. Chambers.
My pleasure.
We'll be back in just a little bit.